Another school shooting in America and two more young lives gone. A high school freshman near Seattle opening fire at lunchtime. He kills one, injures several others, and kills himself. Police haven't assigned a motive, but we're told it might be over a girl. Let's put this news to our political panel. Tammy Bruce is a radio talk show host, and Schoen was an advisor to former President Bill Clinton, both Fox News contributors. And Tammy, I want to start with you on this one. We don't have a diagnosis of the shooter's mental stability, but what's it going to take to bring issues surrounding mental health to the forefront of conversation and cure in this country?
You know, it's been frustrating, and that's the question, Art. I mean, after Columbine, certainly after Newtown, that became the major conversation because it's obvious that there are certain issues, certainly at Newtown. So I remember the whole conversation, I'm sure you did, nationwide, and yet nothing occurred. And I think the problem is that if there isn't in Washington some kind of significant political gain by taking action, no action is taken, that there's only an interest if it suits a particular political agenda. And yet this is what we should be doing nationally and federally when it comes to education and basic standards and, you know, addressing each school and at least sending a message nationally about what is important on these issues. In addition to that, we've got a few years ago, 25% of people 17 and under were on a prescription drug. 2 years ago, it was reported that those on ADHD drugs that are mind-altering drugs, that jumped 46%. So those are issues we have to deal with as well when it comes to drugs, prescription drugs, and minors.
Doug, what do you think is going on?
Well, first of all, let me say that on issues like this, there should be no Democratic and Republican way of thinking. What we need to do is to make sure that teenagers, particularly those with troubled lives, do not get guns. There's no reason for that. I happen to believe that we need a tighter system of background checks to prevent these kind of tragedies. But on a day like today, I think the answer really is to say that we need better parenting. We need better control of the legally available guns that exist in our society. And we all have to pull together as a society to try to help those with serious problems.
Indeed. Let me go to another topic to discuss with you, too. New York City health officials are saying the doctor fighting Ebola at Bellevue Hospital is entering the new phase of his illness. This is just coming into Fox News, but he is awake and communicating. Officials also say Dr. Craig Spencer's fiance will return home this evening under quarantine. And meanwhile, we're now seeing reports that staff at Bellevue Hospital are reluctant to care for Dr. Craig Spencer. The New York Post says staff calling in sick and those who are working are terrified to enter the doctor's isolation chambers. I mean, Doug, so this is symptomatic of what?
This is symptomatic of something else that's contagious in our society, which is fear. We don't have the protocols to treat Ebola. We don't have a clear plan, as Governor Cuomo was saying, to deal with the issues of quarantine. And I think given the degree of uncertainty that exists, we need leadership from the federal government and state governments to have a clear plan and strategy to prevent the kind of uncertainty that is here in New York and indeed arguably around the country.
And Tammy, what's your take on this?
Well, you know, I mean, this is the problem, is that you hear one thing, but then you see actions that are the opposite. And I think that's what's worrying, like nurses groups. Just about a week ago, a major nurses group said that the CDC and the White House had lied to them and was ignoring them. And of course, we know the two who've contracted it here were nurses. These are the frontline people. So we're seeing, not just in the public, we're seeing contradictory, mixed messages about if it's safe, but then we see the government and officials doing things like sanitizing the doctor's entire route that day. On the other hand, we're told that if you've got the hazmat suit on and you're following protocols, you won't be infected. It seems like what we're being told is different than what the officials are doing, and that does not breed confidence when it comes to the nature of who's going to be at risk and if we really are more at risk than what the federal government is saying.
Doug, I actually have 10 seconds left.
Sure.
I'll give you the last word.
I think we really need to pull together and do what, as a society, we always do, which is to stand together to conquer illness, infirmity, mental illness, whatever it may be. And with a divided election coming up, I think we can hopefully all agree on that.
Stand together. Here,
Stand
here.
together.
Tammy, Bruce, good to see you. Doug Schoen, good to see you as well.
Thanks
Thanks to both of you.
Thank you.